If you've had the experience of having an infection, it's likely that you've received an appointment for a dental filling. Fillings for dental cavities are utilized to restore teeth damaged due to dental decay or injury. There are a variety of types of fillings for dental use, and each has their own benefits as well as drawbacks. In this short video, we'll look at the various kinds of dental fillings and talk about the advantages and disadvantages of each. 1. Composite fillings. Composite fillings consist of an amalgamation of glass and plastic. They're tooth-colored, which makes the popular option for fillings that are prominent areas of the mouth. Fillings made of composite bond directly to teeth, giving a durable and long-lasting restoration. They also have a lower risk of infection in comparison to other fillings because they need less dismantling of tooth structure that is healthy. The downside to composite fillings is that they're more susceptible to wear and staining than other fillings. Additionally, they tend to be more expensive than amalgam fillings. This could be an obstacle for certain patients. 2. Amalgam fillings. Amalgam fillings consist of an amalgamation of different metals, which include mercury, silver, copper, and tin. They've been in use for more than a century and are renowned for their durability and strength. They are also affordable and are a preferred option for those on an income. The main drawback to amalgam fillings is the silver-colored color. This can cause discomfort to certain patients, particularly in the prominent areas of the mouth. There is also concerns about the usage of mercury used in amalgam fillings. However, research has proven that the amount of mercury that is released by these fillings is low and is not detrimental for health. 3. Gold fillings. Gold fillings are an amalgamation of gold with other metals like copper and silver. They are renowned for their longevity and durability that last for 20 years or longer. Gold fillings are biocompatible. This means they can be tolerated by the body and will not trigger allergic reactions. The only drawback to gold fillings is the cost, since they are typically the least expensive choice to fillings for your dental. Also, they require several appointments for placement, since they're made by a dental laboratory prior to being attached with the teeth. 4. Ceramic fillings. Ceramic fillings, often referred to as porcelain fillings, consist from a tooth-colored material. They're highly attractive and blend seamlessly into the natural teeth. Ceramic fillings also resist to wear and staining, which makes them an excellent choice to restore your teeth. The main drawback to ceramic fillings is the cost, due to the fact that they can cost more over composite ones. Additionally, they are more susceptible to cracking and chipping as compared to other fillings. Therefore, they might not be suitable for those who grind their teeth or use clenching techniques. 5. Glass ionomer fillings. Glass ionomer fillings are made of a mixture of glass, acrylic, and fluoroaluminosilicate. They're tooth-colored and release fluoride to help to shield the teeth from future tooth decay. Fillings made of glass are affordable and simple to put in, which makes they a preferred option for adults and children who have cavities that are not load-bearing regions within the mouth. The main drawback to glass ionomer fillings is the inability to last, since they wear out quicker than other kinds of fillings. They also are more susceptible to breakage and could require replacement sooner than fillings of other kinds. There are many different kinds of dental fillings that are available, every one with their own benefits as well as drawbacks. The most appropriate kind of filling you need is dependent on your personal requirements and preferences, and also the place and the size of your cavity. It is important to talk about the options with your dentist in order to decide the most effective course of action to protect your dental well-being.